Hello and welcome. Today we're diving into the complexities of a congenital heart defect called tricuspid atresia. This serious condition impacts blood through the heart and requires comprehensive understanding and management. Let's explore what tricuspid atresia is, its causes, effects, and how it's treated. The exact cause of tricuspid atresia is usually unknown. It's a congenital defect, meaning it's present at birth. In most cases, it's believed to arise from a combination of genetic and environmental factors that affect fetal heart development during the early stages of pregnancy. There isn't one specific gene known to cause it, making it a complex condition to pinpoint definitively. Tricuspid atresia essentially means that the tricuspid valve, which normally sits between the right atrium and the right ventricle, is completely absent. Instead, there's a solid sheet of tissue blocking blood flow. This prevents blood from flowing directly from the right atrium into the right ventricle. As a result, the right ventricle is usually small and underdeveloped. To survive, babies with tricuspid atresia rely on other heart defects, like an atrial septal defect, or ASD, which is a hole between the atria, or a ventricular septal defect, or VSD, a hole between the ventricles, and often a patent ductus arteriosus, or PDA, a vessel connecting the pulmonary artery and aorta that should close shortly after birth. These defects allow blood to reach the lungs to pick up oxygen, and then circulate through the body. Without these, the baby would not survive. Tricuspid atresia is a relatively rare heart defect. It's estimated to occur in around 1 to 5 out of every 100,000 live births. It accounts for around 1 to 3% of all congenital heart defects. While it's considered rare, its impact on those affected is significant. The signs and symptoms of tricuspid atresia are usually noticeable soon after birth. The most prominent sign is cyanosis, a bluish tint to the skin, lips, and nail beds, caused by low oxygen levels in the blood. Babies might also experience shortness of breath, rapid breathing, fatigue, poor feeding, and poor weight gain. These symptoms indicate the heart's struggle to effectively pump blood to the body and lungs. Diagnosing tricuspid atresia typically begins with a physical examination where a doctor might detect a heart murmur. An electrocardiogram, or ECG, can reveal abnormalities in the heart's electrical activity. A chest X-ray provides an image of the heart and lungs, showing their size and structure. The most important diagnostic tool is an echocardiogram, which uses ultrasound to create detailed images of the heart, confirming the absence of the tricuspid valve and revealing any other associated heart defects. While there aren't distinct types of tricuspid atresia as such, the condition is often classified based on the presence and nature of other heart defects. Specifically, doctors look at whether there's a transposition of the great arteries, meaning the aorta and pulmonary artery are switched, and the size of the ventricular septal defect, a VSD. These factors influence the severity of the condition and how it's managed. Treatment for tricuspid atresia usually involves multiple surgeries. Initially, a medication called prostaglandin E1, or PGE1, is administered to keep the ductus arteriosus open, ensuring adequate blood flow to the lungs. The first surgery, typically a Balloch, Taussig shunt, or a modified version, is performed soon after birth to create a new connection between an artery and the pulmonary artery, increasing blood flow to the lungs. Later, a Glenn shunt may be performed, connecting the superior vena cava directly to the pulmonary artery. Finally, the Fontan procedure is often performed, redirecting blood from the inferior vena cava to the pulmonary artery, allowing deoxygenated blood to flow directly to the lungs without passing through the heart. These surgeries aim to improve blood flow and oxygen levels, improving the baby's overall health. In some cases, a heart transplant may be considered, especially if other interventions are not successful. Unfortunately, there is no known way to prevent tricuspid atresia. Because the exact cause is usually unknown, preventive measures are challenging. However, ensuring a healthy pregnancy through proper prenatal care, including avoiding alcohol and smoking, and managing any pre-existing medical conditions, can potentially reduce the risk of congenital heart defects in general. The prognosis for individuals with tricuspid atresia has improved significantly over the years due to advances in surgical techniques and medical management. While long-term complications can occur, such as heart failure, arrhythmias, and protein-losing enteropathy, many individuals can now live well into adulthood. Ongoing research focuses on improving surgical outcomes, developing less invasive procedures, and understanding the genetic factors involved in congenital heart defects. Recent advances include refined surgical techniques and improved post-operative care, leading to better long-term survival rates and quality of life for those affected by tricuspid atresia. Regular follow-up with a cardiologist is essential for monitoring heart function and addressing any potential complications.